So, all right. So, Eric, please, you have the whole word. So, you're the president of the coaching of All Star Dental Academy. We have a few coaches over here. We have Cheyenne. We have Shelly over here. So, everybody else is ready to go.
Yes, and Lynn, hygiene coach Lynn, should be joining us shortly, which would be great. Today's topic is canceling the cancellations, which we know can be very costly. So the first thing, there's three sections to this: diagnosing how much of a concern it is for you, then looking at how to prevent them from happening, and then third, looking at, well, if it does happen, how does my team handle the cancellation, and where do we draw the line, and how much of this abuse do we take? So let's first start with diagnosis, and Shelly and Cheyenne, you guys jump in, just talk whenever you need to. Most of the time, I think you guys would agree that cancellations happen on the hygiene side more frequently than the doctor. Would you guys say?
Yes, I'll say yes.
Yeah. Okay. Yeah. Hygiene has a tendency, for some reason, there's that perception that the doctor appointment maybe is more respected or more important. There's more value there. And so you have to understand there's two reasons why people cancel an appointment. They cancel an appointment for lack of urgency or value, right? Oh, it's just the cleaning, or the tooth's not bothering me, or whatever it may be. And then the second reason would be they don't understand or respect your time. They don't understand how you schedule. They think it's just a 15-minute appointment. That's why we hear things like they say, "Oh, I wanted to give you plenty of notice. I can't make my appointment this morning at 8 a.m. Put someone else in my slot." And over here, they say, lack of urgency. "Oh, it's not bothering me. I'm going to go ahead and wait." So we want to negate both of those reasons when it comes to our verbal skills, so you can prevent it. So understanding that the hygiene cancellation happens more, but let's say we'll be conservative. Let's say you end up with one cancellation a day in the hygiene schedule. Somebody who works 4 days a week, and we'll be conservative at the 150 per day. That's what, 600 per week. That's we'll call it 20. We'll round up 2,500 a month, right, for one hygienist. So 2 months is 5,000. So I don't know, extrapolate that. What's that? 25, that's 30, gosh, 30, I can't do the math now. It's over $30,000 a year. Shelly, you're about ready to say something?
I'm doing a calculator.
use a calculator. It's too late in the day for me to figure that out.
30,000.
Yeah, $30,000. Okay. All right.
Average.
And that's low, but one opening 4 days a week in hygiene, $30,000 a year. If you have two hygienists, just double it, 60,000. Now, if we can get to one opening a day, that's a little 12% open time. Our goal is less than 5% open time in hygiene. That's what our goal is for our clients, and it's doable. It's doable. We've had clients have months with no openings in hygiene, so it's absolutely doable. And now more than ever, with how busy we are and how booked out we are, it is even more realistic to expect that there's no hygiene cancellations. Okay, so let's say a two hygiene practice, right? Two hygienists, 4 days a week, 8 days, that's $60,000. All right, Shelly and Cheyenne, Lynn, you guys help me out here. 60,000. And let's say doctor times were 500. So, and the doctor ends up with 1 hour, 4 days a week. Okay, so now we're talking 2,000 a week times, we'll just do 50 weeks. There's $100,000, right? Pretty quick math. So you're talking about 160. If each provider, three providers, had 3 open hours a day, every day, 4 days a week, that could be as much as $160,000. So significant enough for us to pay attention to. Mm-hmm. And I also know 1 unit, 10 minutes of time wasted a day in our efficiency every single day, all year long, is like taking a week's vacation. So imagine an hour. That's an expensive haul. That's like taking 2 months off. Might as well just take 2 months off at that point for $1 million practice. So we know it's a problem. We know we want to prevent it. Because of that, we have to create a rule in our practice. So our office rule is we teach people how to treat us. The asterisk is we just don't do that with policy. Policy is when you're ready to get rid of a patient, when you're ready to charge them, that's down the line. Before we ever get to policy, we teach people how to treat us just with our verbiage, because they don't understand the urgency and they don't understand how you and respect your schedule. We're going to fix that with words. So we're going to go through some prevention first. I think that's an ounce of prevention is worth a pound of cure. So prevention, and then if we get calls, how do we play defense on it? Okay, make sense so far? Okay, so let's give you some systems to implement right away to help prevent cancellations, and we'll start with hygiene since there's more going on there. Okay, you have to understand. Think of it like an urgency scale. When we talk about objections, I think we did objections last time, I think is what we did. So I talked about this a bit, is I believe that lack of urgency is the biggest objection that we deal with, even though people think it's money, time, fear. Well, I see people who say they can't afford it and they drive nice cars and they're on their way to Orlando to go to Disney World, right? So we know they have the money, but it's lack of urgency that gets in the way, lack of value. So think of it like a timeline of urgency in your life. So Cheyenne, when you think about your life, okay, let's see if you get this right. There's no right answer. I'm just teasing. In a timeline of your life, what was the most important event in your life that stands out to you?
My wedding.
Everybody says their wedding, but actually it was your birth, because you wouldn't have your wedding without your birth. Okay, no, I'm teasing. I'm teasing. Yeah. It's like wedding is way up here on that timeline of urgency. And then beneath that, maybe what's second underneath there?
Graduating.
Yeah, graduating, obviously. And then you hear things beneath that, like, specific events that stand out to you, vacations, moments, even sometimes, a funeral you attended, right? Other marriages you attended, ceremonies you attended, all these things in this urgency timeline. Now, Cheyenne, most people's timeline looks pretty much the same. Okay. Mm-hmm. Way up here. It's not in timeline order. It's just in order of importance. In that timeline order, where does the hygiene appointment rank in moments of their life?
Well, is it just a cleaning?
Yes, exactly. It's way down here, just a cleaning. Now, here's the question. Who put it there?
Well, we teach people how to treat
That's
us.
Right.
So we did.
That's right. We did. And by we mean dentistry. We mean physicians. We mean chiropractors. We mean eye doctors. The medical appointment has been placed way down here. Well, let's just get you scheduled for your cleaning in 6 months. This real basic conversation that is teaching them how to treat you. So the results you're getting are based upon the actions you're taking. If you don't like the results you're getting, you got to change the actions you're taking. So those that are video are not on listening to this, down here, those listening to the recording, I want you to start paying attention to what are you hearing in your office as we wrap up the appointment and we talk about the next visit. We hear things like this. Shelly, managing practices for all those years, coaching offices now. Here's what we hear. All right, Shelly, we're all set. Just need to see him in 6 months.
Yeah. Ridiculous.
Don't
People do it to me in the medical field, and I feel uncomfortable because I know that's not what they should be doing. Yeah. And it's like you want to go in and coach your physician's office.
People who are serving. Yeah, you're the patient. Yeah.
This is a valuable appointment. I know it is. Yeah. There's got to be more to this.
And we'll have Lynn. I'll set Lynn. Lynn, I'll give you a heads up here. I want you to be ready to do a transfer as a hygienist. I'll be the patient, and you'll transfer me to Shelly here in a minute. But I want to show you the system of what she's going to use before she does it. Our hygiene coach, Lynn. So here's some things that we can do to take that cleaning visit way down here in the urgency timeline and bump it up. Now, we're not going to get it above ceremonies and weddings and graduations and birth, but we're going to give it some urgency so they don't think it's just a cleaning. It's just a basic appointment. So here's 4 systems that you can use right away. All right. Now, if you know these systems, you'll be able to rattle these off and your team will go, okay, we're going to do that. So the first is reason for return. So Lynn, in hygiene school, I know that all hygiene schools teach some version of this, right? Reason for return. What do we mean when we say reason for return?
It's something that you're wanting to get the patient to look into, like an inflammation, maybe wanting to check it again next visit.
That's right.
It could be a deeper pocket next time. Yeah. So yeah.
Anything that's conditional about from a diagnosis standpoint that we want to make sure we are staying on top of at their next visit. It could even be maintain your oral health. Things look great, so we're going to maintain that. So I'm Cheyenne's the patient. I might say, Cheyenne, I always use the word concerned. That is my favorite word to use when it comes to case acceptance and keeping the appointment. I'm concerned. So I say, Cheyenne, as your hygienist, I'm concerned about helping you maintain your oral health. I can't tell you how many people we see that go beyond the recommended intervals for their appointments with us in hygiene, and they end up with problems they didn't know were even coming. Okay, so I'm just going to pause there. So even a healthy patient, I can create urgency and value to what we're doing. Now, second step we do will be about understanding and respecting our time. But the first step is about creating urgency and value, reason for return. And within reason for return, there are 4 steps. I share the condition. I'm concerned about X. I'm concerned about your gums, right? I'm concerned about the infection in your gums. I'm concerned about the inflammation in your gums. I'm concerned about the bacteria buildup. I'm concerned about the buildup on the tartar on the lower teeth on the tongue side. You've got to explain something in layman terms. You cannot simply say, I want to get you scheduled for your cleaning. Okay. So for those that are just joining, we're working on a 4-step system to preventing cancellations in hygiene called reason for return. So I'm concerned about I'll just use buildup. I'm concerned about the sensitivity you are having on the lower right. Now, Cheyenne, second step is then get the patient to acknowledge it. They acknowledge the buy-in. I'm assuming you're concerned about that too, Cheyenne. Am I right?
Oh yeah.
Okay. And they lie about other things like how often they floss and all those sorts of things as well, but they'll go along with you. Number 3, you're the expert now. You have buy-in. Now you make a recommendation, and you use that word recommend. So in that case, Cheyenne, I'm recommending that we see you no more than 6 months from today. It's important to give it a deadline, no more than 6 months from today. Now, Shelly, on the insurance side, what are we going to hear in response to that?
Will my insurance cover it in 6 months? Today?
Okay. All right, Shelly, 6 months in a day then. That's all I'm going to give you, though. We got to stay on top of this. Okay. And so 1, 2, 3, I'm assuming you're concerned about it too. Great. I'm recommending that we see you no more than 6 months from today. Number 4, ask for the appointment. Cheyenne, how about we go ahead and get that appointment scheduled now so we can stay on top of this?
Sounds good.
Now, what do most patients say not most patients, a lot of patients say when you go to schedule an appointment in 6 months? What's their typical response to that?
I don't know what my schedule is going to look like at that time.
Yeah.
Now you do.
Yeah, exactly.
That's my favorite response.
Yeah.
Now you do.
Yeah. Just put me down for something. If it doesn't work, I'll let you know. Great. I love that. Right. This is the common phrasing. So we're working against that. This verbiage is built specifically to negate that. So if she says that, I have now going to step 2. I want you to respect my time. She basically just told me, look, that's okay. If I need to cancel it, I'll let you know. Well, first of all, maybe she didn't get the urgency and value that I was trying to express, first of all, about the timeline. Secondly, she doesn't know how we schedule. So I'm going to go into that part 2 now. Okay. Part 2 is it's a reservation, not an appointment. So let's say Cheyenne says that as the patient. She says, you know what? I don't know what I'm doing in 6 months. Just put me down for something. If it doesn't work, I'll let you know. Typical response. I say, oh, well, reservation, not an appointment, 3 steps. I say, I'm going to be reserving an hour of my time just for you, Cheyenne, in 6 months. The reason we do that is so that you have my undivided attention, therefore access to the highest quality service we could provide. And the only way we can do that hold that much time for everybody, meaning I see 8 patients a day, that's it. I'm not filling my schedule with a bunch of people hoping everybody shows up. We're specifically reserving time for me, for you with me. And so the only way we can do that is if we get everyone's help. Keyword help. Will you do me a favor, Cheyenne? Will you please hold an hour of your time in your schedule just for me? Does that sound fair?
Yes, it does.
Okay. So I'm educating on how we schedule. I'm teaching people how to treat me in that process, creating value and urgency. Here's a reason for return, like Lynn talked about. And then here is how I schedule. It's a reservation. It's not an appointment. At All Star, we call it setting the great expectation, prioritizing the commitment, creating value. And in our online training, Heather does an amazing job at going through this and explaining it in detail. There's lots of different ways you could do this. I'm giving you one version of this. Okay. Makes sense so far? Okay. So 2 systems. One is 4 steps, reason for return. One is 3 steps, reservation, not an appointment. Now, hopefully at that point, I'm helping them understand how they're going to be treating me moving forward, and I'm preventing a cancellation, right? Now, Dr. Young, let me ask you a question. How far out is your hygiene schedule booked right now? Like if somebody were to reschedule, how far out are they booked?
My assistant, which is my wife.
Yeah, looking over at the spouse here. Yeah, assistant.
Well, someone calls in right now. I'm into the middle of August.
Yeah, so we're 2 months out to schedule a hygiene appointment right now.
Right. Yes.
Right. Okay. So now think about the reason for return that we gave them. Right. We gave them a deadline of no more than 6 months from today. But here's the key thing: teach them how our schedule works. They don't know you're booked out that far. Okay. They don't know how far you're booked. So we're going to use a third system. We call it be the massage therapist, not the chiropractor. I haven't come up with a better name yet. Okay. Now, what are we talking about? Let me back up a step. All right. So who sees a chiropractor? Anybody go see a chiropractor? All right, Shelly. I don't know about you, Shelly. My chiropractor, all right, Dr. Pierce, my chiropractor, Kenzie, she's adorable. She scheduled the appointment. I wander out by myself. Lynn is going to teach us how to make sure we don't wander out. Our patients wander out. She's going to do a transfer here in a second. I wander out by myself after the appointment. I've been told when I'm coming back. I just make up my own mind. I'm like, I don't know, 4 or 6 weeks, whatever. I don't know, put something in. I don't know what my insurance covers. And then I go, what about this? Oh yeah, it's just a 15-minute appointment. We can get you in any time. Yeah. Whatever works for you. Shelly, is that what your chiropractor says too?
I'm pretty sure they have about 200 people on one doctor's schedule in any given day.
Yeah. It's like, gosh, 15-minute appointments there are at least 24 to 50 patients a day in a chiropractor office. So do they really care if you cancel? They'll just 15 minutes. They don't have to wait that long. It's not as much value lost on 15 minutes. So it's easy to schedule. It's easy to get in. It's easy to reschedule. It's easy to cancel. Their text messaging says, it leads with, please do not respond to this text message canceling your appointment. If you need to reschedule, call us at, and then it says your appointment is. It's like they put that at the beginning.
The cancellation.
Exactly. I wonder if you have an issue, right? It's when you cookie cutter, you create your policy based around cancellation. You're focusing on that. Your patient's focusing on that. That's not the priority. Should be keeping the appointment, not what do you do if there's a cancellation. Okay. So instead, in the same building, I see the massage therapist. He refers me to the massage therapist, work on specific areas of my neck. If you see me, I'm always doing this thing. So when I schedule with her, she does her own scheduling like a hygienist would, right, Lynn? And she says to me, so I reserve an hour of my time. I reserve an hour and a half of my time for an hour massage for you. I see 4 or 5 patients a day. I'm now scheduling 4 to 6 weeks out at a time. It's imperative that we get this scheduled right so you don't end up going 8 to 12 weeks in between appointments.
Right.
You hear the difference between a chiropractor and the massage therapist? Now, like Shelly, I'm listening, we're listening to these professionals. And we as coaches, we go, oh, that's good, or oh, that's bad. Don't say that, right? This is the responses we have. So we took that and just said, all right, let's put this in dentistry. All right. So first system, reason for return. Second system, reservation, not an appointment. Third system, be like the massage therapist. So I say to Cheyenne, as I schedule this appointment with me in exactly 6 months, I want to keep something in mind. I'm scheduling right now 2 to 3 months out for appointments with me. Okay. So what that means is if you got to that point where you said, hey, just put me down for something, and if it doesn't work, I'll let you know. And we get to that place, right? And you decide this isn't going to work for me. You're going to end up going 8, 9, 10 months in between appointments. Now I'm concerned about reason for return again. Does that make sense? Mm-hmm. So it's imperative that we get this right the first time. I only see 8 patients a day. I reserve an hour for everybody. Does that make sense to you? Does that sound fair?
Yep.
Okay, great. Now, this is again built to negate in response to prevent that whole, well, put me down for something. If it doesn't work, I'll let you know. Okay. Keep in mind, when we put all of 4 of these systems together, it's about a 2-minute conversation. This seems longer because I'm teaching it, but it's a 2-minute play, right? And I'll do a whole version with Cheyenne, and then I'll have Lynn do the transfer, which will be an added bonus for you guys. So 4th step. We just started teaching this about a year ago. It's from the book Atomic Habits by James Clear, where they did a study on getting people to show up, being committed to your habits, right? Like going to the gym. And they got a 91% improvement rate in the show up rate when we said one thing, okay? Having the person announce when they will be here. And if you ever had a patient, I don't know, Cheyenne, you ever have a patient come in on the wrong day at the wrong time? That's not what you have them scheduled for. You know, you wrote it down right. You know, you talked to them right. Has that ever happened?
Oh yeah, just yesterday.
Oh, okay. So we get this patient show up. You look at them, they look at you, and like they're fine. And you look at them, and go, oh no, what am I gonna do now? I got no time for them, and oh gosh, they're gonna tell me they can't come in, and then they're gonna reschedule anyway. Mm-hmm. So we take that same theory, that same process, and go, wait, let's make sure that doesn't happen. So I say, Cheyenne, I see you're putting your appointment in your phone. I'm putting it in my software here so that we make sure that you show up at the same time that I have you down for. Share with me what you have down on your phone, and I'll make sure that's what I have on my computer. When will you be here?
June 15th at 7 p.m.
All right, I will see you then. June 19th at 6 o'clock. No, okay.
I'm like, no.
All right, just see if she's awake. All right, so they're going to replay back to you when they're going to be here. That's what you want to hear. It's an icing on the cake system. So 4 simple systems. I'll run through it. All right, Shelly, you time it, okay?
Okay.
All right, here we go. So Cheyenne, I am concerned about just helping you maintain your health, but also staying on top of that buildup that's on your lower teeth there on the tongue side that we showed you the pictures of and talked about, okay? And I'm assuming you're concerned about keeping an eye on that and taking care of it every time you're in, am I right?
Oh yeah.
Okay, great. Well, in that case, I'm recommending that we see you no more than 6 months from today, okay? How do you feel about going ahead and getting that scheduled right now and staying on top of this?
Yeah, I'd definitely like to find a time.
Okay. Now, if she says something that we don't like too, I can work with that too. And I say, all right, so I did reason for return reservation. I'm going to be reserving an hour of my time just for you in 6 months. The reason we do that is so you have one-on-one attention, quality care. We're always going to provide that for you. So to continue to do that, I need your help. We need all of our patients' help. What we ask is that you also hold an hour of your time just for me in 6 months. Does that sound fair?
Yeah.
Great. I'm scheduling right now 2 to 3 months out for appointments. So it's imperative that we find a time in exactly 6 months that we know will work for you. I don't want you to end up going 9 months in between visits. And then now we've got a bigger concern with that buildup on those teeth like we talked about, right?
Oh yeah, that makes sense.
Okay, great. Well, let's find a time. And then I go through either or. I got this or that. Then I say, all right, she chooses something. And I say, great, Cheyenne. So I'm putting it in my software on my schedule. I see you putting it in your phone. Share with me when you're going to be here so I make sure that's what I have on my system.
Mm-hmm.
What do you have down?
June 19th at 7 p.m.
June 19th at 7 p.m. That's exactly what I have. Awesome. Thank you so much. All right, Shelly, how much time?
1 minute, 28 seconds.
Yeah, you can do it in 2 minutes. So teaching all of this stuff is not complicated. So what we don't want to hear, like Lynn, when she coaches hygienists, I don't have time for all that. That's not that much time to teach people how to treat you. Okay.
And it takes a lot less time to do that than fill the appointment.
Oh, so true.
Fill
Amen.
the appointment, save the appointment.
Yes.
All of the things that go into it. Yes.
Absolutely agree. Now, there's a statistic that we study in our KPIs that also piggybacks this and helps. Lynn, all right, when we look at our KPIs, we look at our tracker, and we look at that hygiene department, those 2 columns next to each other. Talk about what do we want to see? What number do we want to go up? What number do we see go down when that happens? What do you know what I'm talking about?
Yeah. I want to see your Perio percentage go up.
Yeah.
Baseline is 30%. If you go below that, you're under diagnosing.
Yeah.
And what goes down with it when it goes up is your broken appointments and opening or in your hygiene schedule. It just fills it up. It's a inverse proportion to each other.
Yeah. It's like inflation and unemployment or something. I'm not an economist. I don't know. But when your Perio goes up above that 30% mark, your cancellation goes down. Why is that, Lynn? Why do we see cancellations go down when Perio goes up?
Because now, first of all, we were able to impart to the patient the importance of keeping their teeth. And that's by the time you already imparted their concern. At the same time, you are not just scheduling one visit, you're scheduling several visits.
Yeah.
And these are important visits because these piggyback on each other. You just don't want to do one quadrant and call it quits.
Yeah.
And then at the same time, the 3-month interval for perio maintenance that comes with it, or in the 6-week evaluation, adds to that number of appointments. So.
Yeah, so that solves the problem one, lack of urgency or value. The urgency, well, if I have to come in I can't come in every 6 months anymore. I have to come in every 3 months. I just went through this whole perio process, right? I have to see the specialist, the periodontist, Dr. Pires, 3 months, and then I see Dr. Young 3 months. I got to stay on top of this. I don't want to go back through that again. They have a higher perceived value or need, therefore they're less likely to cancel. So as you see that perio go up, you see cancellation go down. By the way, Lynn's coaching with this. If you want coaching, hygiene coaching help, Lynn is amazing at this. But I'm going to give away a little bit here, Lynn. If you are seeing your perio go up to this number, this healthy number, it's because you're doing one thing in your practice. You're doing periodontal evaluations, and you're doing that on every single patient. So the other 70% of patients who come in aren't perceiving it as just a cleaning. They're seeing it as something more than a prophy, therefore increasing value and urgency. And even the healthy patients now have a higher show up rate because they value what you're doing. I hope it's okay I shared that secret, Lynn.
Please. And also I want to share with you about just the cleaning. Because in my office, we said to everybody, you don't say just the cleaning, because that's a limiting term for hygienists. It's like, oh, it's just a cleaning, I can cancel. But if you say it's your hygiene appointment that is important for your maintenance, for your health, then that's a different story.
Yeah, so true.
The limiting words.
Limiting terms.
Limiting terms.
And it says right in my notes, I have notes just like anybody else, right? Eliminate limiting terms. So you took the words right out of my mouth. Watch it. Hey, we're going to watch it, right? Why, Shelly, why is watch it a limiting term?
What exactly are we going to watch?
Wait, I'm leaving.
It's not going to get better on its own.
I'm leaving right now. How are you watching it? Yeah.
What are we watching?
Yeah. So do you have a term that we use to replace that? So the patient hears something different. What do we say instead? What do we do? What if I want to watch something, but what do I say?
As far as,
I don't know, is there verbiage that we use to replace that term? Like as a dentist or hygienist keep saying, hey, we want to watch this, but I don't want to use that term anymore. Do you have a suggestion on what we say instead of that? Or
I ask
about monitor.
Monitor it.
Evaluate it later,
Reevaluation. I like reevaluation. I like that. I'd say just drop it. And I think, Shelly, where you're going with it too is, are you pregnant or not, right?
Yeah, like that's where I was like, what are you wanting us to say here, Eric? Because truly, I mean, it's not going, if you're identifying a condition, it's not going to get better on its own. That's why you guys are doctors. You're there to help, and hygienists, there to help with that condition and to restore health. And so it's not going to do it on its own. It's going to get worse. We're waiting for pain or tooth loss to occur by just monitoring. They can be in their very early stages, absolutely. But you're going to be as minimally invasive and as least expensive now.
Earlier on,
So that's hygienist start. Let me tell you, docs, is when we set up the patient and you say, yeah, we'll just watch it later, or it's a perio situation. Oh, you can come in 6 months and we'll check it again.
Yeah.
So when we set up a patient, that is your cue to say, oh yeah, and support your hygienist that way.
You got to be on the same page. You got to be calibrated.
Yes, if you have to be calibrated, and your hygienist is a driver of your restorative appointments.
That's right.
Your hygienist can help you build your appointments as well.
So let's talk about that. I love that, Lynn. So scratch your back, I'll scratch yours. Doctors, here's something you could do to prevent hygiene cancellations. At the end of every operative visit, every time you see a patient, this is for doctors. And if you need to, have your assistant kick you in the shin so you remember, do this. So I say, Cheyenne, I'm so glad that you saw Lynn when you did. Oh, wait, I'm Dr. Vickery. I got to sit up and talk. Sorry, Cheyenne, I'm so glad that you saw Lynn when you did. In fact, because you saw Lynn, we caught this before it became an even bigger problem. I see that you have your next appointment already scheduled with her in 4 months. So you're on a 6-month cycle. That's perfect. I cannot stress to you enough how important that visit is to help prevent these sorts of appointments from happening. Does that make sense, Cheyenne?
Mm-hmm.
All right.
It's super important for the doctor to do that too, because if you think about who the patient sees as the most powerful person, it's the doctor, right? So it's super important for the doctor to set it up for the hygiene visit, and that will start preventing the cancellation too.
Yeah, good point. In other words, who's perceived as the most powerful person in the office?
Mm-hmm.
Yeah, the doctor.
The other thing I've noticed actually is when we say, I try not to say we'll watch it or we'll monitor it, because I've noticed that when we used to do that, and we did that a lot, to be honest with you, we'll say we'll watch it. And then guess what? The next appointment comes, I'm busy.
Yeah, he's cutting out, but I know where he's going. He's saying the next time that patient comes in, I don't go to the exam, and now it devalues the urgency. Yeah, you cut out there for a second, Dr. Martinez, but I know exactly where you're going. So, all right, let's talk.
Or the patient does develop some discomfort at some point between visits.
Even worse.
Like, you said I could just watch this. Why didn't we address it back when it was the first condition to begin with that was identified? So instead, by showing them the condition by pictures, iTero scan, whatever it is, and then asking them, what do you want to do with this? Put it back in their hands. Let them understand and own their own condition. And then they'll drive that decision. And if they choose to not do it,
then it's
at
on
least
them.
you don't have to eat crow when they are in discomfort. You can say, well, we had this conversation.
And on that note, WIDIAM. Everybody know what WIDIAM, the acronym WIDIAM is, right? Would I do it on me? So if you're a dentist looking at a situation, say, or my spouse, would I watch this if this were my spouse, or would I do something about it? That's the question you have to be asking. And if you would say, yes, I would take care of that for my family, people I love, why are you not presenting it there? And that may be, most likely, is a sign of approval addiction. It could be something else. I'm so busy, I don't have room for this. That could also be a concern. Okay. Let's talk about transfer of care. Lynn, this is your wheelhouse. So we're going to talk about transfer of care. So once I have Cheyenne dialed in like this, right? I'm going to now use another step in prevention, okay? Preventing by having Cheyenne hear again as we transfer to Shelly exactly, and this is psychology, okay? This is psychology happening. Cheyenne's going to hear again how we're teaching her how to treat us by preventing cancellations. So 3 simple steps, always 3 or 4 steps, right? 3 simple steps, 3 words: concerned, wants, important. Okay, that's all you got to remember: concerned, wants, important. And what we're doing is, again, we're selling the condition. We're creating urgency. I'm going to so it could sound like, Shelly, Cheyenne and I are both concerned about helping her maintain health and really take care of those lower teeth that are getting the buildup and the tartar between our 6-month appointments. Okay. 2, wants. Instead of saying needs, she wanted to go ahead and get her appointment scheduled in exactly 6 months. We already did that. I told her 6 months and a day. That was it. Okay. That was the leash to stay on top of this. Okay. Important. It's really important for her to have peace of mind, knowing that she's not going to end up with anything that could really create a problem for her in keeping her teeth. Right? And then I look at Cheyenne and go, right, Cheyenne? Okay. So Lynn, years and years and years as a hygienist, training hygienist, how do you do this? Why don't you take Cheyenne to Shelly admin? You be the hygienist, Cheyenne's your patient, you transfer over. Give us, and I'll time it. I'll see how long this takes.
Okay. So I'm taking Cheyenne to Shelly. Shelly, Cheyenne has just seen doctor for an exam, and I also did her evaluation. And doctor and Cheyenne are concerned about this buildup of the lower right that she's having some sensitivity with, and also concerned about the area on the lower front that she's building up a lot of tartar. So doctor and I recommended that she comes in no longer than 6 months in a day, and and Cheyenne wants to schedule this because it is important for her to not have any aggravated problem later on and prevent some future pain and discomfort. Isn't that right, Cheyenne?
Yes.
All right. 41 seconds. 41 seconds to prevent cancellations. I mean, so you take those 4 steps we did before in the hygiene room, and maybe you don't schedule chairside. That's fine too. You can schedule up front. I don't really care, but 2 minutes, take 2 minutes of your time at every appointment and save $160,000 a year, right? That's what we're talking about here. So thank you, Lynn. Very nicely done. I really appreciate it. Dr. Martinez, yes.
I that some of the hygienists are actually setting up their own appointments. In my office, my front desk is the one that sets up all the appointments. So we have one of the front desk personnel related to like the hygiene department.
Mm.
So what's your recommendation? What do you guys think works best? Is it best for the hygienist to set up their appointment?
No, I get what you're saying.
My practice is a little different.
Yeah, you have like a prosthodontic practice, right?
I have 2 part-time hygienists because I really don't have a full-time hygiene department.
Yeah, as a problem. So if she can handle the bandwidth of that, totally fine with her scheduling it. The theory was when we shifted, maybe, I don't know, Shelly, 10 years ago? Or Lynn, like when did hygienists start scheduling chairside? About 10, 12, 13 years ago?
I've always done it.
You've always done it. So it's been around sorry, Lynn, forever.
Forever. Okay. It's a new record, people.
Wow.
So you just told us your age.
I love it. So
Big Ben.
I think it works if they're doing it the right way, chairside. I think it also could be detrimental if the hygienist going, all right, well, let's get you set in 6 months. All right, put that in your bag. All right, we'll see you then. And they're on their way. I think that devalues what we're doing. You know, somebody who's passionate about keeping the schedule full, like an administrator, I think sometimes carries more weight. And so I'm totally fine with that as long as you're following these systems to do that. So chairside up front, doesn't matter to me. Shelly, what's your perspective on this?
We like our hygienists to do it because they've built all that value and they have that connection with the patient. They already know them.
Yeah.
Worst case, you get a transfer like what Lynn just did, and then that value is just repeated right in front of that patient. They're hearing it again. But as long as you're having the conversation, the hygienist is having the conversation that Eric was basically laying out there, one of his 3 4-step rules that he just gave us, then you're going to be fine. It's just they have to truly understand that they're building the value of that appointment in that in closing and scheduling.
So the more times they hear this process, the more committed they are to it. So 4 things: reservation on appointment, reason for return, reservation on appointment, massage therapist, atomic habits. If you remember those things and how it works, and now it's going to take practice and repetition to do that. Replay this video over and over and over again for your team. In All-Star, we have all kinds of cancellation stuff that deals with this. We're just scratching the surface here. Things that you can do. It's simple psychology in your communication that changes your results. All right, doctor side, I'll simply do this. If you can focus to create urgency on the doctor side, it's about the condition. What's wrong, and what is that going to lead to if they do nothing? And what we hear on the doctor side is, oh, Cheyenne, thanks for calling me. I was just getting ready to call you. You know what? That tooth, it's not even bothering me. So I'm going to go ahead and wait, right? No pain, no problem, no pay. So what happens is their perception is nothing's wrong because they're not feeling anything. So that means chair side, that's not Cheyenne's problem that patient canceled. You know, that's not her fault. It's my responsibility as the clinician, chair side, 2 weeks ago, to make sure that I emphasize not only what the existing condition is, but what's going to happen if you don't do anything, and how long it takes to get in on the doctor's side, right? 4 weeks right now, maybe more in some practices. So that perception the patient has is, it's been like, I haven't seen the dentist in 2 years. It's been like this for a while. It's not bothering me. I can wait. That is a sign or symptom that you missed something 2 weeks ago, chair side. Okay. So just because of time, we'll set that aside and say, hey, that's a whole session in itself. We talk about 95-5 rule. We talk about focus on condition and consequences. Okay. Because I want to give us time to talk about the phone call. Cheyenne and I, we're going to talk about this. So
if I can add, when you do all of that value that Eric was just mentioning, making sure that you, your hygienist, your assistants are documenting that reason to return very clearly in layman's terms of exactly how you communicated that to your patient. I know we get caught up in doing all the clinical jargon, but that's not going to help your administrator to be able to follow the process on the phone, to be able to relay it back. Because most of our administrative team doesn't know what some of those terms even mean, to be able to put it into terms for that patient, to try to
layman terms, and it's documented. In fact, you're going to hear us. We can't save an appointment on the phone when they cancel if Lynn, the hygienist, didn't do that 5 months and 29 days ago, right? So we're going to go to reason for return for that. So I want to stress something. We talked about perio percentage. You know, the fact it just happens to be that there's a periodontist in the room. And what happens with a periodontist in the room is you have this amazing second opinion. So if you have an existing patient, you've referred to perio, they've gone through it, and they're seeing you every 6 months, and in between that, they're seeing the periodontist every 3 months, it is a value to you to have them see both places. You might think, I want them just in my office every 3 months now. That is not what we want. You want that second opinion of that person that thinks just like you, saying, yes, this is important to stay on 3 months. Because what's going to happen is you get them out of the periodontist office, you get them just seeing you for 3 months, and after about maybe not even 2 years, Lynn, what's the patient going to ask for now? What next thing are they going to request?
Well, what is the next thing that I have to do?
Yeah, they're gonna start begging and pleading and saying, okay, well, do I have to come in every 3 months now? Right?
It's not a value anymore.
Yeah,
they're gonna see their condition as gone.
That's right. I don't have to see the periodontist anymore, and now let me just come in every 6 months. I mean, they ask for that even when you just present scaling and root planning to them. Okay, so I wanted to stress that, and I wanted to come back to it for a moment. Okay, so make sure that when you're sending a patient to the periodontist, you're focused on that 95%, the condition. Send the periodontist, even if it's not Dr. Pierce, cover your ears, okay? Any specialist, prosthodontist, no matter who it is, whoever you're referring to, put the diagnosis. Stop putting evaluate for crown on number 3, evaluate for surgery on upper right quadrant, evaluate for, and you put treatment there. Stop doing that. That's doing a disservice to the patient. That's a prescription pad. Please prescribe something with, Cillin at the end. I don't know what that means, but if I'm a patient and I see the referral pad and it says, I'm concerned about the severe infection, that could lead to tooth loss on the lower anterior teeth, please evaluate. Do you see how that changes the perception of what's happening? And then in response, there's a letter from the periodontist back to the general dentist that also supports, hey, we're getting this place. We can't let this go. We can't let this disappear. Okay, I'll get off my soapbox for a moment. There's just such a synergy you can create or completely destroy if you don't know how to maximize your specialist relationship. Okay, all right, let's do phone call. And we'll wrap up here. So we got like 5 to 8 minutes, Cheyenne, okay? So let's say we do everything right. And that phone call still comes in. By the way, if you start doing this in hygiene today, right? You start using the verbal skills now. Cheyenne, when are they going to start seeing changes in results?
6 months from now.
6 months from now, you'll start getting results. So don't give up because tomorrow you start saying this and the next day you get cancellations. It hasn't kicked in yet. Okay. Cheyenne, when we listen to cancellation calls, do you know, I don't know if you know this or not. Let's see if this will be worth 10 points. Do you know the number one, let's say I call in and say, yeah, I can't make my appointment. Do you know the number one response administrators say in response to the cancellation? What do we say?
The wrong one. Which is, okay.
Yeah, perfect. 10 points. The number one response your administrators give in the dental office when someone cancels is okay. Okay, well, let's find another appointment for you. When we interview people, Robin at allstardentalacademy.com, when she interviews and hires, we'll do a question for admin. Hey, how do you handle cancellation? Oh, I always get them rescheduled. In other words, I'm not letting them disappear. That's not the point. The point is save the appointment. So instead of saying, okay, what do we say instead, Cheyenne?
Oh, wow. I'm sorry to hear that. Is everything okay?
Oh yeah, something's come up. No big deal.
Okay. Well, let me go grab your chart. I'm going to place you on a brief hold.
Oh, it's not that. Oh,
So the point is to not make it easy for them to cancel.
Beautifully
Try to save
done.
the visit.
That's right. Oh, it's like someone's breaking up with you on the phone. You don't go, okay. You go, oh, well, is everything okay? That was perfect, Cheyenne. Good job. And they go, oh, no, it's not you, it's me.
I actually started taking it one step further and saying, even though we have digital charts, I'd say, oh, shoot, give me 1 second. I know that Lynn has your chart. Let me go grab it real quick.
Yes.
He was preparing for your appointment. I'd throw the hygienist or the doctor's name in.
It creates value. Yeah.
There's no paper chart. But
and you have no clout as the administrator to argue for the appointment. You need the ammunition from Lynn's notes. Now, I'm looking for two things in the chart. When Cheyenne is, when she puts me on hold, she's going to look for two things. Cheyenne, what are you looking for?
Have they done this to us before?
Frequency of offense. Yeah.
And what's the reason for return? Because I'm going to bring that right back into the conversation with the patient.
Perfect. So let's say this is, I haven't done this before. I'm not a jerk. You're not going to fire me as a patient. Okay. You pick up the phone and what would you say to me?
If you're trying to cancel?
Yeah, let's pick up right back up. You got my chart. You saw I wasn't a frequent offender. You looked at Lynn's reason for return. What do you say back to me now when you pick up the phone?
Oh, Eric, now that I have your chart, I saw that Lynn was really concerned last visit when she saw you 6 months ago about the calculus buildup you had on the lower right there.
Yeah, I remember her saying something about that. Yeah.
Yeah. Okay, well, I know that she would be really concerned about you rescheduling this visit today because she does not have another availability in her schedule for about 2 months.
2 months?
Yeah. Is there any way we can make this work? I really don't want to push out that
Bubba, just go fishing without me. I can't make it. Okay. So the couple things she did here. Good job, Cheyenne. Is there any way you can make this appointment today? Do you hear how that's the point? That's what we're trying to get to. You get to a place where you can say, can you keep this appointment today? Now, maybe they can't. Maybe the cat got run over. Maybe mama died. I mean, how many times they give you this excuse that mama died? Mama died. This is the third time in a row mama's died and you've had to cancel your appointment with Lynn. But if it's really important, you're still teaching them how to treat you so that it doesn't happen again in the future. Mm-hmm. This is an educational process that she's taking me through. Now, does she need to do all that? She doesn't need to jump through all those hoops. That's an act. It's a process, but you're teaching people how to treat in that process. That was perfectly done. Now, as coaches, we can tell you, coaches, how we teach this, we train this. How often do administrators follow this guideline? If you had to guess a percentage of time, what would you say? They've heard it before. We've trained them on it. How often do they actually do it?
Not very often.
I'd go 50-50.
Yeah.
Might do it.
Coin flip. I would agree. Coin flip. Maybe you get it, maybe you don't. And here's why. I've got to fill the schedule. I'm so busy. I don't have time for this phone call. I've got to call people to fill all the other schedule. And we don't take the time to prevent it. Second possible reason is fear of rejection, approval addicted. I'm worried about what you're going to think of me when I take you through this process. And so there's some coaching that occurs preventively before you can do this. Cheyenne, Shelly, Lynn, they've all gone through coaching on mental toughness, confidence, and no fear of rejection. That is a key foundation principle to implement these verbal skills. So we're assuming a lot of things here. So get the script down. Oh, not okay. Hold on while I get your chart. Last time you saw Lynn, she said reason for return. I'm concerned about it because she doesn't have another appointment for 3 months. Are you sure there's any way you can keep this appointment today? 5 simple steps that you can go through. We call it the oh, not okay conversation. I'm not getting into policy. I'm not threatening anybody to be fired as a patient or to be charged. It's about their well-being. Now, let's go back, Cheyenne. Let's say you look at my record and you find out I am a frequent offender. Okay. I'll throw you a curveball here. So I'm a frequent offender. You pick up the phone, it's going to go differently. What are you going to say now? This is my, I don't know, I'll say my third time I've canceled this last minute. Or even second or third time, doesn't matter to me, either one. What would you say?
I would give 2 options to the patient. If they want to get back in the schedule, I would actually have them pay in full for their visit. So I would just explain, so I have 2 options for you. I know you really want to get in. It does sound like you're motivated to get back in. So here's what we can do. You can either call me the day that you are free, that you know you could be there, and I'll get you in. Or you can pay in full for the visit.
Oh, okay. Good job. Listen, you're ready to lose this patient when you do this, but charging them a fee that's a guarantee to lose, and that's fine. If you want to charge them a fee, it's because you're firing them as a patient. Don't charge them $50. Don't charge them 25. Charge them 150. Are they going to pay it? No, they're not paying it. Nobody ever pays that. And then they go leave a bad Google review. You know, my mom died and they charged me $150. You know, here's a Google review for you, 1 star. Can I give 0 stars? Right? So instead, turn them into a good patient by giving them 2 choices, not a chance. You either come in on a day you know you can make it, you call me, and if Lynn has availability that day, we'll get you in. There's no guarantees. Or you show me you're committed to this time with Lynn, and I'm not going to lose another hour after I've lost 3 from you by paying in advance. It's $287. You could pay for that by phone with a credit card and hold her time. If you reschedule for any reason, that is the fee for missing the time with Lynn. Which would you like to do? And what one are they going to choose?
Call on the day of.
Probably the day of. If they choose to prepay, great. You just created a great scenario for you.
Mm-hmm.
You just turned them into a great patient. It's a no lose for you. And they don't see you as being a jerk. They understand it's the 3rd time you've missed. Okay. Whew. There's a lot more we could cover here. What coaches, what would you add to this? Give us a 2-minute ad and then we'll wrap up.
I would say even what your voicemail says. Don't allow your voicemail to be the cancellation machine.
That's
it's going
good.
to save your team so much headache on Monday when they walk through that door and they see that red blinking light on the phone. So be careful what your machine says. You don't want to say that we don't accept cancellations on the machine, but you would want to say something like, if this is something for scheduling changes or about scheduling, then call the doctor on his home telephone number. Yeah. Are they actually going to call the doctor? Probably not.
And what doctor actually answers their phone anyway? It's good. I like that. Yeah. So your automatic cancellation acceptance machine needs to be turned off, right? Yeah. If you're calling regarding an appointment, please don't leave any message after hours. Instead, call us during normal working hours so we can assist you. Okay, good. Shelly, something you want to add?
I was just going to add where Cheyenne had the call us the morning of. Preliminary to that, the busy person conversation gets inserted in there, especially if they've had to cancel for random reasons, not because they're sick, but work and all of those.
How does that sound? Let's say I've done this a couple of times. Give me that busy person conversation.
Oh gosh, Eric, you're a busy guy, aren't you?
Yeah, I know, right?
About 3 or 4 times now. I mean, we don't let it get to that, but we've had you scheduled for this hygiene visit with Lynn. This is the 3rd time that this hasn't worked out.
Wow.
I'm really sorry. I know she was really concerned, but you know what I feel like maybe work best is, because your schedule just seems to be so tight, if you give us a call on a morning where you know you're going to have some time available, if she has an opportunity, we'll see what we can do to work you in.
Got it.
How does that sound?
So what you're doing is you're really appealing to my my arrogance or something first. Hey, you must be really busy. And I'm sorry that you're so busy. This doesn't work for us either. And you're being very nice about it. Yeah, the busy people conversation. Love it. Oh, thank you, Shelly. That's a good point. All right, Lynn, what about you? Anything you want to add to this?
Yeah, just one thing. Do not let the patient get away with not scheduling. And because I have this experience where I had a hygienist who is not into scheduling her own patients. And I tell her, it's your future. It's your future schedule that's going to be empty. Yeah. So I just want to impart the importance of scheduling ahead of time.
It seems so
get away.
It seems so basic, but you're absolutely right. I'm shocked. It's almost an assumption we make as coaches nowadays, just to assume everybody's doing this. I mean, when I went through Jenny D. St. George and all, Linda Miles and all these consultants back in the day, one of the number one things I did was you got to pre-appoint your patients. And I'm going, duh. And I'm looking around the room, people are like, oh, okay, yeah, we're gonna pre-appointment. I was like, what are you doing? You're waiting for people to call you back, and you're sending out postcards to remind them they need an appointment. That's just too much work. And it doesn't stress the importance of it. 100% of your patients should be pre-appointing. 100% of them. If they're not understanding the value of what's going on. There's no urgency. That's a problem of what we're saying chairside to help them understand their health and the consequences of that. Okay. Whew, 1 minute, Dr. Paris. Speaking. I'm like 500 words a minute right now. Hopefully
yes, you are.
Nobody's listening in 1.5 speed on YouTube.
People will miss it.
Listen, I'll say a couple of things. One, if anybody wants support like what we offer, Dr. Paris, we're here for you. Shelly, Lynn, Cheyenne, Eric, Heather at allstardentaLacademy.com. Just email us. We're here for you. Just call us up and talk to us. We're happy to support you. You need time with someone for a quick consultation. We'll jump on the phone and help you. We have seminars all over the country, leadership, case acceptance, where we'll be in Portland, Maine in October. That's our next one. Up in Cheyenne's neck of the woods. And we were just in Florida last month. If you missed us, we'll be back there again next year. So, and then of course, support Dr. Paris in this. I think, Dr. Paris, you would like to have no cancellations in your hygiene department on your doctor's side as well, right?
Yeah, definitely.
Work together. GPs,
working together is great.
Yeah, prosthodontists, GPs, periodontists, work together on that referral stuff. Empower one another. Seeing two people, it's like having that second opinion. So is there anything, Dr. Paris, you want to add to this as far as supporting one another and preventing cancellations?
No, basically it's exactly like that. Talking with the patient, the necessity or why they want it, have that follow-up treatment or anything like that. So if you show the urgency, most of the time they're not gonna reschedule, they're not gonna cancel. It still happens. It still happens in my office anyways. But yep, over time we just gotta get things right.
That's exactly right. That's exactly right. Yes. Yeah. It's so much easier to, if you noticed, we spent a lot more time tonight. What, 90%, 85% of the meeting was on preventing the cancellation. We spent a very small amount of time worrying about handling the cancellation call. That's a shot in the dark, especially if you're not using the stuff on the preventive side. If you're using the stuff on the preventive side, it will work some of the time, but you got to use the system. Like Shelly said, coin flip, right? So it has to go hand in hand. You can't use the defense, the phone call, if you're not using the prevention side of things. Okay. Make sense? Awesome. All right. 1 minute over, Dr. Paris. I hope that's okay.
That's okay. That's okay. So,
all right.
Just
if anybody have any questions for us that's out there in the Zoom world, feel free to jump in now, ask a question. Okay. Speak now or forever hold your peace. Yeah. I see Dr.
No cancellations come 6 months from now.
Well, let's meet. We're going to meet in what, 2 months? We're going to meet in 2 months. Let's see if you can implement these systems and start seeing what sort of results you're getting from it. I mean, $160,000 floating out there on average. So let's go get half of it at least. That would be nice. This could have been a $80,000 meeting for you. That would be nice. Just help cover the cost.
Yeah, awesome. Definitely. So 2 months from now, another Study Club coming up with all of us, with Eric and everybody else.
Yeah, it'll be fun.
So yeah, that'll be the last pretty much August, correct? So last week of August. And then for all of you guys that I just want to quick reminder, we have our Study Club next week. Hands-on with me, Dr. Martinez. So hopefully, Dr. Young, also David's going to show up over there. So let's see if everybody's going to show up also in our next week's Study Club in live.
Love it. Love it. Good to see you guys. Dr. Egnetz, great to see you. Take care. I'll see you guys all soon.
All right.
Thank you.
Great
night. Thank you.
Thanks.
Thank you
guys.
Thanks for coming. Thank you.